Good morning, everybody, and welcome to this meeting in public of the NHS Commissioning Board Authority. It gives me enormous pleasure to welcome members of the public to attend the meeting this morning, both in person here in Newcastle, but also, as everybody is aware, our meetings are web streamed live, and they remain on our website to be viewed after the event. And that's a very important signal of the way in which this board operates. I should explain that we do business in private, which is a formal meeting at which we consider matters which are confidential for commercial or for HR purposes, or because they relate to particular relationships with the government. And we are committed to doing the bulk of our meetings in public, in the public eye, in order to symbolize that this board belongs to the public. It is a patient-oriented, a patient-fixated, obsessed organisation, and our business needs to be conducted in such a way that relays that openness of approach. Some of the business that comes before us at these meetings is business on which the non-executive members of the board and the executive members of the team have worked together in development sessions to try to develop the business. But this is still a formal meeting of the board at which we have papers, we listen to an outline of the paper, we challenge, we think about the way forward for the board. I should emphasise that this is the last meeting of the NHS Commissioning Board Authority. From the 1st of October, we become the NHS Commissioning Board. By that I mean that we cease being a special health authority in a transition stage and developing the work for the board. And from the 1st of October, we assume the status which is conferred by the Health and Social Care Act 2012. We then have 6 months of continuing preparation up until the 1st of April 2013, when we assume the full functions and responsibilities of the NHS Commissioning Board. In the interim, as we shall learn more of this morning, we will be undertaking a wide range of preparatory activity, but in particular the formal process of authorisation of the clinical commissioning groups. So delighted to be able to welcome everybody to the meeting this morning, and I now turn to the formal business. The first item of which is to report an apology for absence from Margaret Casely-Hayford, and then to proceed to note that there is no fire alarm test due to take place during the course of this meeting, so if there is an alarm, that is a serious alarm. The first formal item of business is to ask my colleagues if you're willing to approve the minutes of the previous meeting as an accurate record, and whether there are points arising from those minutes to which you would wish to draw our attention. No, thank you very much. May we then